Hello dear students, welcome to Dr. S. Medicine classes. In today's class, let us learn about methylxanthines. Methylxanthines are commonly used drugs in COPD and in the asthma patients. So methylxanthines are naturally occurring alkaloids which are usually present in plants like Thea sinensis and in Coffea arabica. So Thea sinensis is a tea plant actually. So Thea sinensis is a tea plant, and in tea usually we have different methylxanthines, and methylxanthines are also present in Coffea arabica, which is a coffee plant, and in that we find few natural methylxanthines. And in natural methylxanthines we have three different forms, so three different chemical structures. So listen guys, this is a common structure of methylxanthine, and here we have three methyl groups. In this, actually this is the basic structure of xanthine molecule, and in this xanthine molecule we have three different methyl groups. So on the first position there is one methyl group, and on the third position we have another methyl group, and on the seventh position we have the next methyl group, and we have three different methyl groups in the xanthine. So the chemical name of this structure is 137 trimethylxanthine, and this compound is also called caffeine. So caffeine is one of the methylxanthine which is present in Coffea arabica coffee seeds, and is also available in Thea sinensis, which is also called tea plant, and in tea leaves we find these molecules. And other than this compound we also have two other forms, which is called theophylline, and in the theophylline actually on the first position and on the third position we have two different methyl molecules. So in theophylline we call 1,3-dimethylxanthine. 1,3-dimethylxanthine is called theophylline. So this is the second molecule or second naturally occurring methylxanthine in the Thea sinensis and in the Coffea arabica. And we have third molecule which is called theobromine. And in theobromine actually on the first position and on the seventh position we have two methyl molecules or two methyl groups. So 1,7 dimethylxanthine is called theobromine. So theophylline, theobromine and caffeine are three different naturally occurring methylxanthines which are usually present in Thea arabica and in the coffee seeds. So now let us try to discuss in detail the pharmacology of methylxanthines, their pharmacological actions, mode of action, their side effects, adverse drug reactions, drug interactions, and finally uses of methylxanthines. And remember one important point, methylxanthines are most commonly used in COPD condition. And another important point about theophylline, these are narrow therapeutic drugs. Due to the narrow therapeutic activity, most commonly we don't use methylxanthines in the hospitals, and we have some other very effective drugs like beta agonists like salbutamol, salmeterol. We have inhalant corticosteroids which are very effective in asthma and COPD. So because of that drugs we don't use theophylline and methylxanthines commonly in the hospitals. However, in some cases theophylline and these methylxanthines are useful in some cases like COPD. So let us discuss the pharmacology of methylxanthines in detail now. First we'll go with the pharmacological actions of methylxanthines. So while talking about the pharmacological actions, methylxanthines, and remember methylxanthines are non-specific drugs. They don't have specific actions on specific systems. They act on almost many systems in the body. So we'll come from the top. So what are the pharmacological actions of methylxanthines on CNS system? On CNS system actually methylxanthines will have stimulant activity. So they stimulate the brain, spinal cord and different nerves in the body. So they are called CNS stimulants. That is the reason most commonly many working candidates and in the nights usually many students also keep drinking tea and coffee and some beverages to awaken the time and to have anxiety related problems. Okay, so these methylxanthines are having CNS stimulant activity, so that in some conditions many people take tea coffee to increase their CNS activity. Okay, and remember one important point: when high doses of methylxanthines are taken, they causes severe anxiety, insomnia, and some other CNS related disorders. So this is very important. So better low doses are very much effective when compared with high doses. High doses will have severe lethal adverse effects of methylxanthine. So on the CNS system they have CNS stimulant activity. And next, on the cardiovascular system, this is very important. On cardiovascular system, actually methylxanthines are having cardiac myocyte stimulant activity. Usually they increase the cardiac force of contraction, and it also increases the heart rate of the heart. So it increases the heart rate and it increases cardiac output. But remember, it reduces or it dilates the blood vessels in the peripheral tissues. And very important point, methylxanthines actually these drugs causes vasoconstriction property in the cranial nerves or in the skull. In the skull they causes vasoconstriction, and due to that property usually methylxanthines are sometimes used as headache conditions. In headache conditions we use methylxanthines. Okay, so that is important. Because of that head related, in the skull the blood vessels are constricted by methylxanthines. Because of that property we use these drugs in the migraine conditions. Migraine is very important, and usually in headache conditions most of the people take tea coffee for headache. Okay, because of that property it will reduce the migraine conditions. And next, on skeleton muscles, actually methylxanthines increases the force of contraction of skeleton muscles by increasing the calcium in the sarcoplasm. So this is important point. And by this actually it increases the force of contraction of the diaphragm muscles and intercostal muscles, and that helps in asthma and COPD to increase the inhalation and exhalation. So okay, this is important point. And next we have some other pharmacological actions of methylxanthines. And methylxanthines on the lungs, this is very important, and I'll explain the mechanism here itself. So when methylxanthines are taken, methylxanthines they try to inhibit phosphodiesterase enzymes in the lungs, and by inhibiting the phosphodiesterase enzyme, it increases the cyclic AMP, and by that it increases the dilation of the smooth muscles or bronchial smooth muscles. It dilates or relaxes the bronchial smooth muscles, and by that in asthma patients methylxanthines will act like a bronchodilators. So this bronchodilator property helps in asthma patients. Okay, so methylxanthines are used in the asthma and COPD patients because of this mechanism. So on smooth muscles it relaxes most of the smooth muscles. This is important point. And next, on GI tract. GI tract is very important. Methylxanthines directly stimulate the smooth muscles of the GI tract, and it also directly stimulates the production of gastric acid secretion. So gastric acid secretion is very important. So in peptic ulceration conditions methylxanthines are strictly contraindicated. So this is very important on GI tract. And on urinary system methylxanthines has mild diuretic property. So on urinary system it has diuretic property. It reduces the reabsorption of sodium and water from the tubules, and by that it increases the excretion of sodium and water. This is diuretic property in the urinary system. And yeah, so these are some of the pharmacological actions of methylxanthines on different systems. And now let us discuss the clinical uses and clinical points about methylxanthines. We'll see some interactions actually. We will see, first we'll discuss about different formulations of methylxanthines. You listen guys, methylxanthines we have theophylline, Usually theophylline is the most commonly used drug. Other than theobromine and caffeine, we use theophylline as most commonly in the hospital. Actually in the hospitals we use theophylline because it is having good efficacy and it is also having less side effects when compared with caffeine and theo. Okay, so theophylline common dose is 100 to 300 mg. And remember, in this theophylline we have different molecules. Theophylline is not water soluble. It is non-soluble in the water, and that is the reason theophylline can be used by oral route. So theophylline is used in oral form. So oral sustained release tablets are available in the hospitals. Okay, oral sustained release tablets are available. So this is about theophylline, and most of the time these methylxanthines are absorbed from GI tract, especially theophylline. Theophylline is absorbed from the GI tract, and most of the methylxanthines are metabolized in the liver, and after metabolism they are excreted through urine. And theophylline, after absorption, it is distributed in almost all the tissues. It crosses blood-brain barrier, and in all the tissues it is good distributed very well. Okay, so that is about the kinetics of theophylline and related compounds. And we have aminophylline. Aminophylline is the analog of theophylline, and aminophylline is a salt form. Actually, aminophylline is a salt form of theophylline, and it is soluble in water, where theophylline is not soluble in water. It is soluble in water. So aminophylline can be given through oral route or IV route, and most commonly it is given in IV form, IV route. And remember, aminophylline should be infused for up to 30 minutes to 1 hour. And remember, this aminophylline should not be mixed with other drug compounds before administration, and it has so much incompatibilities with other drugs. So it should either mix it with NaCl or with water, and it should not be mixed with other drugs like multivitamin injections or some other compounds. Okay, this is very important. It should not be mixed with other compounds. So this is about aminophylline. And next we have etophylline. So etophylline is another form of theophylline, and this form is soluble in water, and it is available as oral form as well as in the IV form. It can also be used in IM, intramuscular route also. So this is important thing. Aminophylline is having high irritation property, whereas theophylline is not that much. So these are three different forms of theophylline, and we have another important form of methylxanthines, that is derifylline. Derifylline is oral form. Actually, derifylline tablets are available in the market. So listen, derifylline is a brand name, and in this derifylline we have two different forms. One is etophylline. So 80%, it is about 80% etophylline and 20% theophylline. Okay, so this combination etophylline plus theophylline is called derifylline, and usually 77 mg of etophylline is combined with 23 mg of theophylline. So this combination is usually called derifylline, and it is having some it is available as tablets. So derifylline tablets are available in the market. So these are some of the compounds about methylxanthines, especially theophylline analogs and different formulations of theophylline and their dose calculations. And okay, so now let us see, in the hospitals we also can use caffeine and theobromine, but in asthma and COPD patients we use theophylline analogs and theophylline salt form and other components of theophylline only for asthma and COPD. Caffeine also can be used, but most commonly we don't use, and caffeine, sometimes this caffeine product is mixed with some other drugs for migraine related disorders. But in asthma COPD we don't use caffeine as drug of choice. And listen, in asthma and COPD even theophylline is not a drug of choice. It is the third line or fourth line drug. Actually, first and second line drugs we have beta agonist like salbutamol, salmeterol, and we have some anticholinergic drugs, and we also have corticosteroids which are very effective in acute asthma conditions. Okay, so Now let us see the drug interactions of methylxanthines. Methylxanthines drug interaction. This is very important, because when theophylline is given, because of its narrow therapeutic activity, so theophylline sometimes it will be easily metabolized, and sometimes it increases the toxic levels in the body because of some drugs. So because of that reason, we have to study the drug interactions about methylxanthine. Listen, we have some drugs, the drugs which increases the enzyme activity in the liver. So they are called enzyme inducers, and enzyme inducers especially, just remember phenytoin, phenobarbital, and rifampicin. So these three, so these are commonly used drugs actually. So phenytoin, phenobarbital, and rifampicin are drug inducers. So they induce the hepatic cytochrome P450 enzymes, and when the enzymes are elevated in the liver, the metabolism of theophylline and methylxanthines will be increased, and by that it reduces the activity of methylxanthines. So when the drugs especially phenytoin, phenobarbital, and rifampicin are given along with methylxanthines, we have to either increase the dose, or we have to remove these drugs when methylxanthines are given, because these drugs will increase the metabolism of methylxanthines, and by that it reduces the activity of methylxanthines. This is very important interaction. And we have some drugs, the drugs which inhibits the hepatic cytochrome P450 enzymes. In that we have erythromycin, cimetidine, and ciprofloxacin. So erythromycin, cimetidine, and ciprofloxacin are the drugs which inhibits the cytochrome P450 enzymes of the liver, and by that, actually by the inhibition, the metabolism of methylxanthines reduces, and by that it causes the toxicity of methylxanthines, and by that many ADRs are possible. So while giving these drugs, we have to maintain the ADRs, and when the methylxanthines are given along with these drugs, we should definitely reduce the common dose of methylxanthines. So this is very important interaction. So these are some drug interactions and their effects. And listen guys, there are methylxanthines being the narrow therapeutic drugs. When the small alteration in the dose, if the dose rises in the methylxanthines, we have severe ADRs, and ADRs especially tachycardia. Arrhythmia is very common ADR with methylxanthines, and sometimes gastric irritation, gastric acid production, insomnia, and anxiety and related ADRs are very common with methylxanthines. Especially cardiovascular arrhythmia is very important ADR about methylxanthines. So that is about ADR. And finally, listen guys, methylxanthines are third line or fourth line drugs in the asthma COPD, and sometimes methylxanthines are also used in migraine conditions, and it is having mild diuretic property. And because of all these reasons, methylxanthines are especially used in asthma and COPD patients. And remember few important points about methylxanthines. They are narrow therapeutic drugs. They should not be given along with erythromycin, ciprofloxacin, or cimetidine, or some other drugs which induce the cytochrome P450 enzymes or reduce the activity of cytochrome P450 enzymes. So this is about methylxanthines, and please, if you learned something from our video, please subscribe to our channel, like our channel, and please do share with some other medical professionals. Thank you for watching.